jump in with a question. Somebody wrote in and said, my Asperger's 14-year-old son has sensory issues while cleaning his teeth and taking a bath. When he cleans his teeth, he says his ears and head itch him. And when he bathes, he feels like he is in prison, sometimes gasping for breath. And what can we do to help him?
Yeah, it's fascinating. One of the things that has changed in autism, perhaps, or we're learning more, is this whole sensory aspect of autism. Of course, in the old days, there used to be a lot of children who would have very significant sensory problems and would really, I remember one of the early diagnostic criteria, and I'm not sure, DSM-3 maybe, was insensitivity to pain. And it just, a lot of the kids would just fall and injure themselves and not have any sensation of it. Now we look at sensory issues and they vary. Cleaning your teeth, I can imagine, would be somewhat of a sensory problem. It's understandable, but he's also saying that it hurts his ears or itches his ears. And I don't know if he has allergies. You really might want to have an allergist take a look and see if he has an allergic reaction to anything, or if he's just, to pollen and so on, has slight allergies. Because then if you're on an antihistamine or some sort of medication for allergies, it might resolve that altogether, because itching is not a common issue when it comes to sensory dysregulation in our kids. Right. Itching could very well be a real allergy. So let's first of all rule that out. Now, once you've done that, I would say that you just need to get very sensitive toothpaste, Sensodyne, I guess, and very soft bristles, and allow him to do the best he can with it. And I don't think that beyond that you can do too much. In regards to bathing, I think that, I'm not sure, I understand he's still taking a bath. Perhaps you would try a shower instead, and perhaps you would give him a handheld shower so that he has control over where the water goes, so that he doesn't feel like he's suffocating in the bath water. I don't know if the heat is too much for him. Generally, if it's too high of a heat level, then we gasp for air. So just play with those things. I mean, these are essential activities for him. They're hygiene activities. So you do need him to continue to do them. Making them a little bit easier this way, giving him control. Generally, if you give someone control over something that's uncomfortable, they do much better with it. Discomfort tends to increase when it's unpredictable. So, that's why really good dentists, for instance, will tell you everything they're about to do, and that helps because you're prepared a little bit. So if he's holding a handheld shower, for instance, it'll help him because he will actually be able to put the water on himself and remove it rather than being in a bath where you're stuck. And then I would reward him more, increase your reinforcers for things that are difficult. So these are difficult tasks for him, so make sure he has a high reward after doing these tasks.
Wonderful. Great advice. And then always, we love it when you guys write in and let us know what you did and how it worked and what the results were, and I think the audience loves that too, the rest of the audience, because we learn from each other. So it's a great opportunity. Moving on to another question. Good morning, ladies. I have a teenage son with autism. If he is mad at me, usually over something really minor, he completely ignores me the rest of the day. No eye contact, no response. It's like he can't get over whatever little thing happened. What can I try to improve communication and thanks?
Right. I noticed that you skipped one that was just telling you what a wonderful show you have.
I did skip that because I wanted to address that, and I wanted you to see how much people love the show. But
no, that's wonderful. Yeah, it's lovely to see that, and it's lovely to see people writing in from other countries, such as India. That's wonderful.
And we totally appreciate. We like everybody else love the reinforcement, and
we need the reinforcement.
And and honestly, because I have said to our audience, sometimes it feels like I call this my padded room sometimes, right? Because there is some padding, and that sometimes it feels like we are in here by ourselves.
Oh yeah, of course.
And we are always thinking about all of you and hoping that you're getting what you want out of this, but we don't know for sure unless you tell us.
It's true.
So.
I don't know how you do this, actually. I was thinking about it. Wednesdays are pretty fun. I mean, after this show, it's of course Nancy, and Nancy's always fun to have. I can talk to Nancy for hours, and I wouldn't even know how that passes. But it is a tough job to be doing this 3 times a week. It's very tough.
It is, but it's also a great gift to me.
It absolutely is.
And I get to meet people I would never have met.
It's fabulous.
And I get to learn things that I don't know that I would have learned.
Right.
And it's different every day. And so don't feel bad for me.
That's very nice. Good, thank you.
It's wonderful.
So going back to this question, I never mean to make an issue small, but I love this issue. It's sort of a nice thing to have, is that it shows how intelligent and sophisticated your son's thinking is, that he holds a grudge. I mean, holding a grudge is actually a kind of a very sophisticated cognitive factor, because you really have to remember something that occurred that might have been minor, that offended you. And usually we hold grudges not over things that are very direct, but more abstract things that somehow hurt our ego. So in that sense, it's kind of a nice thing that your son is doing that. I mean, I would say the best thing you can do in this kind of scenario is probably, if something like that happens, make sure that you don't address it. Don't try to go up and beg him to forgive you or pay attention. Don't do any of that. But rather engage in something extremely fun that he loves, that he loves, and do it very overtly so that he's aware that you're doing it. And I think he might engage with you then. Yeah. So it's kind of like entice him.
Absolutely. We've had a little bit of this behavior with someone I know and love. And
this is a very typical, everybody does this.
Yeah, it's horrifying when it happens because it doesn't feel good. But I've tried to remember, I think we've had a question like this before, I've tried to remember that it is a quality problem.
Right. And it's a typical problem. It's not just in our kids, This is something that a lot of adults do. Yeah. Sometimes people need a longer period of time to cool off.
And honestly, I feel like sometimes with Jem, I feel like more and more I get better of going, okay, what is the function? That's almost the first thing that occurs to me. And that sometimes he just needs time. Yeah. And he will even say to me, I'm going to need some time to cool off with this. Right. And I'm like, all to the good, right? Yeah, absolutely. I appreciate, because I feel that way sometimes. I'm upset about it. There's nothing you can say in this moment. I just need a moment, that's fine. And I really like to honor that. There are other times that I feel like he is doing that just to get my attention. And those are the ideal times, like you said, I go and do something fun, and then he gets right over it.
That's right. So therefore, whether it's either a condition, the best thing to do is just to ignore and move on with your life. It's one of those things that our kids learn if they see. It's not an issue when they do it to you. I mean, we as parents can handle this kind of stuff, right? Because nothing is about us, it's about them. Right. But when it comes to the point where the individual does this with peers, and then peers just walk away and they're like, what's wrong with him? That is not good, because now it's affecting his social life. Right. And so, but it's one of those natural things that happens where if your teenager actually wants to have friends, he will learn that doing that type of behavior is affecting his friendships. But for now, I would say this is how you handle it. You move on. You just move on and you do something fun. I remember when my kids were little, I used to do that all the time, no matter, even if they were holding a grudge or not. Immediately, as soon as some sort of tough situation or argument was, once it had escalated and was now over, I would immediately divert to some other fun activity, because you really want to teach your children to move to the next session of life,
Moving on.
Move on.
Moving on, which reminds me that I keep reminding our folks that the last Wednesday of the month we're having Byron Katie on the show. Right. A great person for learning how to move on off of something when you get stuck on an emotion or a page that you just can't seem to get off of, and making it productive. Great things. She will be with us on that last Wednesday of the month. All right, moving on to this next question, which unfortunately I fear is all too common in terms of the situation. Hello, Shannon and Dr. Doreen. I'm currently going through the process of getting a divorce. My daughter is almost 4, and she has high functioning ASD and sensory processing disorder. She has started showing some unwanted behaviors that I'm having trouble dealing with. One is increased aggression towards her younger brother, and the other is urinating on my furniture and carpet. I know a lot in her environment has changed, but how do I make the transition more smooth for her and stop the unwanted behaviors? Her father also is not calling or seeing her that often, which is causing her lots of distress. And I'm also seeing a huge increase in her self-regulating behaviors. She's jumping a lot, rocking, vocal stereotypy, and flapping. Any advice would be great, and they have sent an email so that we can get back to them, which is why I'm not sharing the question on the live feature.
Right. Wow. Yeah. So I'm really sorry. That's a very difficult time that this parent is going through. I'll give some basic advice, but I really think that more importantly, this is a time where you need some support. That would be my first piece of advice, is try to get some help right now, because whatever advice I give, it's going to really require a lot of time. So you need to have an individual who's helping you carry out all of this sort of stuff. And I would imagine you need some support yourself anyway. Yeah. But, these are behaviors that cannot be handled with a reprimand here or there, or an occasional change in consequence, or an occasional change in antecedent. It's more or less someone has to be with her, most of her waking hours. So she's 4 years old, she's high functioning, and she has some sensory processing issues, which a lot of our kids now do. She's showing increased aggression towards her younger brother, and she's also urinating on the furniture and the carpet. Let's not make the assumption that all of this is due to the divorce. Let's just identify the function of each behavior. Okay. So separately, you will need to see, when does this aggression towards her younger brother occur. And these are completely separate behaviors, so we will look at each one individually. So you want to see when the aggression towards the younger brother occurs. You immediately want to look at the antecedents and consequences when that occurs. So for instance, she aggresses towards her brother when he takes away a toy. That's a common scenario. So then she's actually aggressing towards him because he has taken something away from her. So she's trying to get that object back. So you would need, in that scenario, the intervention would be that she should be prevented from doing the aggression, but taught how to ask appropriately, and then given a chance at the toy. So, or if you can't do that, then the situation needs to be avoided altogether. In other words, she should not be allowed to be in the same room playing with the brother, so that could occur. So every scenario has its own type of function, and that's very important. Let's assume she aggresses towards the brother when she wants attention from you. That's another thing, and we have to think, why is that happening? Well, every time she hits her brother, you come out to give her and the brother some attention. Perhaps you give the brother good attention and her bad attention. It doesn't matter. Attention is attention. And so she's learned, hey, if I want mom to pay attention, all I need to do is hit my brother. You really have to identify the function. And yes, we tend to act up when we are under new circumstances, like dad not being around, but we also have to adjust. And so it doesn't matter that you have to leave that alone for a minute and not focus on the fact that the divorce is happening, but really identify the function as it occurs that moment and figure out how to deal with it. And the same thing also for the urination. When is she urinating on the furniture? Is it right after something is taken away, right after a demand is placed? Is it when she has nothing else to do? Whatever the reason is, you then produce an intervention based on the reason. And that's why most of these types of behaviors are easy to eliminate when you have someone with the child most of the time. So that's why therapy is so important if you have a therapist, because the therapist will block and prevent most of these things from happening to begin with. And the therapist also gets to identify those kind of antecedent cues and can identify, oh, she's about to urinate. And so that means I know she urinates when she needs a break, or I'll teach her how to ask to go to the potty, or I'll teach her how to ask for a break, or maybe it's time for me to reinforce more, or those types of things. So each of those behaviors that are occurring, you just need to identify the functions separately. This is a situation where you have enough going on in your life that I really do recommend you have help.
Yeah.
If you can get help from a professional, that's absolutely the best thing, of course. Someone who's a BCBA or perhaps registered behavior technician, or has a board certification in autism, the BCAT, or some sort of certificate that shows that they know ABA. Can easily help you with this. The self-regulating stuff, the jumping a lot, rocking, vocal stereotypy, and flapping perhaps is, kind of regulating her. I don't know. But again, if someone is with her, they will block those types of behaviors, prevent them from happening, and redirect them to more appropriate behaviors.
And can we talk for just a second about if you don't? Because for me, it seems like the danger in this is that, I think it's natural that as human beings we go, well, why is this happening? What triggered this? And then we look at the divorce and we, make that comparison. But for me, I feel like, and tell me if I'm in the wrong neighborhood, but so she's doing things to cope with whatever's happening, right? Mm-hmm. And she's learning from that. And if we don't prevent this, then this will be a thing that she does until she learns that it isn't effective, which could be when she's 42.
Or never.
Or never.
Yeah, and see, something like a divorce, something that's a chronic change. It's not an acute change. It is acute, but then it becomes chronic. It's long term. I see those as background factors. So, for instance, someone who doesn't sleep well, that's one, or someone who's just started a new school, or someone who, there's these factors that affect us kind of in the background and on a longer term. They're not provoking the specific behavior. They're just kind of, they sort of increase or reduce the threshold for us to lose it. Mm-hmm. So it's kind of like I'm agitated because this divorce is happening. So I'm at a heightened state of agitation to begin with. So now if you place a demand on me, I'm going to hit my brother. Right. You know what I mean? So you're at a different, sort of your baseline changes because you're more irritated. But you can't change the base, you can't change that background thing. That background thing is there, and we have to acclimate, like you said, we have to get used to that. So what you do is you take the time to teach the individual that this behavior is not okay. Right. Even if you're in a state of heightened agitation, it's just not okay. This is how we communicate. And, you teach an alternate form of communication that's acceptable. And yeah, you're very right, Shannon. I mean, these are the very important times where we have to teach our kids, I know you're stressed out. I know things might be tough, but it's still not okay to behave this way.
Yeah, and give them the better tools in life for them to have a more productive life. We talk about on this show that this show wants to cover autism from a 360-degree perspective, but I feel like you are the expert in the field that really gets it from the 360-degree perspective, that even before when you were saying there are more things we need to know behaviorally, there are more things that we need to know biomedically, and so much of our world is segmented. You have the people who are doing behavior work and they don't want to talk about the biomed, but the parents do.
Yeah, even in the world of behavioral, there's a lot of splits.
Yes.
Not everybody thinks the same. So there's a lot of kind of division there. There's a huge amount of division when it comes to the biomedical issues, for sure. I mean, it's changing as everything does, but for God's sake, I was almost crucified for thinking that biomed is important. Yeah. Like, when was it, 5 years ago?
Yeah.
Yeah, so it's just, it's a funny world.
It is a funny world, but we appreciate you, and I think that, from my point of view, I think that you are so amazing because you're constantly interested and curious in all kinds of things, and I think it comes from a place of security that you know what you're talking about. So of course you're curious to know more things.
Yeah, absolutely.
And that comes from confidence, and we appreciate that, because I think a lot of people are so hotly defending their position that they can't hear anybody else.
And in positions of power, which is very, very sad, I think few years ago at a national conference, at an ABA national conference, Jane Howard, who's a very high-level behavior analyst, actually showed a video of me where I was speaking with a physician who was doing an interview, and I was basically saying that the medical interventions are very important for some of the children because we need to stabilize them medically and help them feel better so that ABA is actually more effective. And she showed that video and pointed it out as being extremely unethical because as a behavior analyst, I shouldn't be recommending that anybody look at medical interventions. And it's really interesting for me because, and you know, of course, she's in a very powerful position to not only influence other behavior analysts, but also parents. She has a clinic, she sees patients. And I feel bad about that because I feel like there are so many parents that would be misguided. You can't, you know, this is not just a learned disorder, obviously. It's not like we saw our children learn all these things. We can reverse them, most of the behaviors, but for God's sake, we have children who are, you know, I always use this example, but I have children who have diarrhea 10 times a day, and it's ignored because people say, oh, he has autism. There's nothing to do with it. Let's treat his GI dysfunction. Exactly. You know, and it's very important. Like I always say, Shannon, you know, I'm very, very interested in helping on the biomedical side just because I find so many things are overlooked. Our children, so many of our children don't sleep. They really have very poor sleeping habits. Yes, some of it is behavioral generalization. You know, the child doesn't want to go to their own bed or something, but the majority of it is something else. Some of these kids are having seizures. Some are just having very sleep disturbance. Some are so sensory hyper that they hear everything and it wakes them up. I mean, honestly, and some are just have biochemical imbalances that wake them up. And you don't sleep, that's going to affect every other aspect of your life.
Well, it's just common sense.
Absolutely.
It doesn't take, you know, I mean, I don't have to have a PhD to think, that.
Yeah.
And I think that a lot of parents come from that point of view and go, well, but if my child isn't healthy, what are we going to be accomplishing? It could be the best learning program in the world. I feel. But, you know, and I think that's what's refreshing, and we appreciate that you do see it from that 360-degree perspective. And that, you know, the first time I heard you speak and you talked about the whole child,
right,
I just went, oh, you know, this is amazing. I'm so lucky because I was already at CARD when I heard you say that.
Right.
But if I hadn't been, I would have been finding out where your office was to be with your team.
Well, thank you.
Because so few people are talking about that. So we appreciate this time. And we have some questions that have come in the live feature, but I want to take one more that came in earlier this week. From one parent to another, how can I help prepare my son for the upcoming departure of a therapist who has been with him for 2 years? I don't know what the replacement we eventually get along with pending interim reduction in services will ever be able to understand him as well. He gets very, very attached to people. After turning 3 and leaving early intervention, he would ask for his lead therapist for at least another year or 2.
Oh my gosh.
I just don't know how to help him with the transition when I am having a lot of trouble thinking of getting through it myself even.
I know. So this is it's a very difficult thing sometimes for our families. I find this to be the case because, you know, it's funny because initially it's such an intrusion when you have a team of 5 or 6 people at your house all the time, you know, and it's like you don't have a life. It's people are in and out.
Right.
But over years, you actually get so used to not only those people, but just having a team behind you, backing you, helping you, being part of your life, that it's very, very hard to give it up. You know, for your son, some of the things you can do are the following. Just make sure he understands. I mean, the goal here is to make sure he understands that he will continue to be able to have this person in his life in some manner. So what I would really recommend, and sometimes what we do here when it's possible, is we will fade off so that the therapist is doing fewer sessions gradually. But then if your child, depending on the age of the child, it sounds like he's older because 3 is a few years ago, but you would want to make sure that they are in contact perhaps on, let's say, Skype, in contact on the phone perhaps. The therapist could, for instance, send small packages. So in other words, as the sessions decrease, the therapist can, on their own time, just call in and say, hi, how are you? Or just Skype in and wave, or maybe send something in the mail so that your son continues to have some form of contact. It may not be physical contact where the person is coming in, but it'll be sort of other types of contact.
Yeah.
And really, that's the best you can do. And, our children have to experience loss in their lives to some extent. But it sounds like if this is a therapist who's really attached and understands him, then it's probably a nice enough person who will stay in touch. Yeah. I'm in touch with families of kids and kids that I worked with 20 years ago, more than 20 years ago. And it's really nice. It's very, very nice. So that's something that you could do. I always try to say that there's some benefit to having new people on your team. I just want to touch on that for a moment because you know how when our kids are little, we understand, as parents, we understand everything they say, but no one else does. I remember when my son was little, even I couldn't really understand because he heard so many languages in the house. There was German and English and Farsi, and there were many languages. So he had this, it was hard to understand. It was like sort of a German accent mixed with very rapid speech. It was just a very funny. But the only person who could really understand when he was like 1 or 2 was his sister, Nikki. She understood pretty much. So she had to translate everything he said for a little while. He'd say something and she'd be like, he said, blah, 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 And it was funny, but that happens with our kids, where they have a therapist who understands everything they're saying, but no one else does.
Right.
And it's important to have new therapists working with our kids because the new therapist is less trained and therefore more resembles reality. Right. Because a really well-trained therapist is going to prompt him, is going to be higher level of reinforcement than the normal environment, whereas a newer therapist will be closer to what he'll experience in the normal environment. So it's always good to have a rotation of therapists. It's tough. I'm not saying it's not easy and it doesn't always work out, but it's not easy. It's tough, but it is for his benefit in the long run, and it's important that you do that. And I know that we depend on these folks. It's hard.
It is hard. They become part of your family, your extended family. And I just want to say as a parent that, I really relate to this question that we had so many therapists, right? But our personal autism whisperer on our team was Peter Farrig. And I get choked up whenever I talk about Peter because, there's probably nothing I wouldn't do for Peter, for what he did for us. Right. But Peter left us a total of 3 times in our 5 years. And each time that he announced that he was leaving to go away, it was like a personal death to me.
Yeah.
And he was, my son.
Because you worry, you're afraid.
It was like being at a cliff, and how will we ever have this with somebody else? And somebody once reminded me, well, there was a period of time when you didn't know Peter Farrig.
Yeah.
Maybe there's another Peter Farrig that's going to come into your life.
Sure.
And we met lots of other therapists that helped our son along the way. And Peter would come back into our lives and go, look at what has happened with him. And it kind of became a thing with us, a touchstone where Peter would come back in and see the improvement. And even 2 years ago when we were having a school issue and we asked Card to step in and take a look at things, and Peter was the person that got sent because he's had a through line with him. And Jem got to be the ring bearer in Peter's wedding. This is like, Peter is family to me.
Yeah.
And if you quiet yourself with it and know that this person is not gone for you forever, that you can stay in contact if the person is okay with it. Obviously, it has to be okay on their side. That leave room for the fact that somebody else fabulous is going to come in, because we had other fabulous people that I would not have been open to if Peter had been there.
Absolutely.
That added to our team and brought something. And I will tell you, if you need something to get you in the mood to get it, there is the fabulous song from Wicked, For Good, that talks about people coming into your life for a reason and having to leave for a reason, and how they taught you something and they must go, and you've been changed for good.
Yeah.
It's a beautiful.
That's in Wicked?
It's in Wicked.
Oh, okay.
I made a video when Jem graduated from CARD, and the song below it is For Good, to talk about all the therapists that came in and changed all of us for good.
Right, absolutely. And you're so right, Shannon. Like, I look back at, I think it was the second au pair that I had when Nikki was a baby. And I cried when her time was over. Like, let me tell you, she was just with us for 6 months. I cried. I mean, she was just like a godsend, you know? And that was a very tough time for me. It's first child, and I was working a lot, and I was growing CARD, and it was a tough time. And I remember thinking, like, how am I ever going to manage? And then, of course, you do manage. And then, as you said, you know, the person who replaced her actually ended up being just as good, if not in a different way, you know, but just as good, and someone who also played a very important role in Nikki's development and in our lives. And after that, of course, we had maybe 10 other people who were just amazing. So I would say it is always, it's our own fears to a large extent.
And it is. Even here, you know, Emily was with us at the beginning of Autism Live, and Emily and I had this working relationship, and when Emily was leaving to go to the NFL Network, I was like, what will we ever do? We'll never survive. I can't ever. And then we have
Kelsey?
Yes, yesterday was Kelby's 1 year anniversary.
No way. Well, congratulations,
in the last couple of
Kelby.
days. And I, like, if my life had never had Kelby in it, that would have been a horrible, horrible thing.
I know.
So
I agree.
You know, transitions are uncomfortable, but
I agree.
Everything is changing always. We just have to get over wanting stasis, right?
That's right.
That's right. So in any case, okay, we had a question coming in the live feature this morning. Our lovely Shannon and Dr. Doreen. I have almost 6-year-old boy who is very smart and is doing great thanks to his ABA. Though his speech has improved a lot, he still does not initiate conversation or interactions. He also does not comment nearly as much as his peers do during the activity. If he's doing something, he usually is singing something. He might occasionally get my attention and tell me something about it, but not often. How can we increase his commenting, tacting, what he is doing and initiating? And thanks a lot, with about 6 or 7 exclamation points.
That's great.
Thank you.
Let me just write notes
Yes.
so I don't forget. Okay, and then say my question. There's several lessons that are going to be useful to this family. You know, clearly you have some technical knowledge, because you refer to how do we increase his tacting.
You're watching the jargon. We love it.
So the tacting is basically, for those who aren't familiar with that term, is kind of labeling objects, you know, pointing out the names of things, or identifying things that way. Manding being the first form of communication is kind of requesting. So my assumption is that this child does mand pretty rapidly, frequently. I don't know, because if he or he doesn't, then you also want to increase rapid manding, so requesting for things. But tacting, you simply model. And the way to do that is, you could do it when you're driving, you could do it at the house, whatever it is. You are modeling the frequent labeling, and you're increasing its fluency. So, you know, the way that we do it is, you know, we'll teach the child a series of labels, and then we will increase the speed of it, and we will increase the duration. So I would be flipping pictures, and the child would have to label them very fast. That fluency is a very, very important part of initiation of and maintenance of tacting. So, and then you would also just then increase, you would reward, like for instance, one of the ways that you reward is using a clicker for every tact. Anything that the child labels, you would increase. You would give a click for, and then the number of clicks would equate to some reward. Mm-hmm. So you generally want to work on just reinforcing and increasing the number of tacts and the duration of tacting. And that's just tacting, that's labeling. That's not necessarily going to increase initiation of conversation. Conversation is quite a different beast, and it involves a lot of different things. One big factor of conversation is reciprocity, being able to exchange. So you also have to kind of teach that, because you know, when you're tacting, you're just labeling. You know, there's a fire truck, this is green, there's the tree, you know, those are just tacts. But when you're having a conversation, I'm basically saying something and then waiting for your reaction. And that exchange is kind of a difficult thing to teach. A couple of our lessons, first of all, we have a huge social conversations section, which is in our social curriculum, which I recommend you look at. Any of these lessons that I'm referring to are, of course, in the skills curriculum, and I really highly recommend that you look into the skills curriculum, because in the social conversation sections there you'll find tons, and I'm not sure if they're the social curriculum or language curriculum, but you'll find tons and tons of lessons that will focus just on conversational speech. For instance, one of the things that we do is this lesson called statements, where you begin with, you'll say something like, you know, I have yellow, and then the child will have something in front of them and they'll say, I have green, whatever it is. And that is just teaching the child, the content doesn't matter what it is, right, but it's very basic exchange of information. And then you'll take it to more advanced stuff, like I ate, you know, cereal for breakfast, and the child says what he ate, and yesterday I did whatever, and the child says, so it's just an exchange that's parallel, kind of. And then you take it to the next level lesson, which is statement question, and that is kind of like, you know, asking each other, saying a statement, and then the child, you have now a rotating question and statement.
So you say to me, I have yellow, and I say, do you like yellow?
Yes, exactly. Or I had breakfast, and I ask, what did you eat for breakfast? So, and these are all written out very, very precisely, because it's kind of an expansion on speech. In fact, as I was saying this, I remembered when I made those names. Like, I didn't know how to come up with those names, how to identify those lessons. And there's many more. Like, when you get into heavy conversation, then you have to really teach the child to identify facial expression and be able to, for instance, figure out cues as to the interest level. They have to be able to pick a topic that is specific to the people they're talking to. So, you know, you can't go, I would not go to my children, for instance, and have a long conversation about autism, although I do at this point in life, but, you know, I wouldn't when they were younger. And so those types of things are important, but they're more advanced. And, you know, the child is only 6. So at this point, you're really looking at other children who are 6 and the type of interaction and conversation they have. They do identify what everyone wants to talk about. You know, a 6-year-old will know what they can talk to their girlfriends about, what they can talk to the teacher about, that sort of thing. And so it starts to become pretty complex, and I recommend you look at skills. And skills, of course, is skills4autism.com. You can write it out or use the number 4. Both of them go to the same place, skills4autism.com. And I think that's really the place to go, because you'll see hundreds of lessons that will work on conversational skills.
Yeah, it's kind of so exciting to read through it once, just to kind of read through what the different topics are, because you will go, oh, immediately I know as a parent, you'll go, well, that's a part of what we don't have.
Right.
And want to fill in the blanks, and it's crazy good what can happen when we fill in those blanks with a child. Very exciting. So skills4autism.com. And there's help and support if you need it. And you can always, I love to help people figure out skills, because it's one of my favorite things on the planet.